my name is Paulina Aguirre. I'm a student physical therapist student here at Pierce University. Today we're going to be going over the precautions and contradictions for joint mobilization, with our reference being our Orthopaedic manual therapy and evidence-based approach by Cook, which is going to be referenced in the description. Okay, to get started, hi, my name is Paulina Aguirre. I'm a student physical therapist student here at Pierce University. I'm going to be asking you some questions just for precaution and contradiction for joint mobilization, just to make sure that we can continue with our manual and joint mobilization. Is that okay if I ask you some questions?
Yes.
Okay. Do you have any history of DVT or any blood clotting disorder?
No.
Okay. Do you have any fractures, dislocation, or surgeries within the last 8 to 12 weeks?
No.
Okay. Do you have any history of cancer?
No.
Okay. Do you have any bone disease such as osteoporosis or osteopenia?
No.
Okay. And do you have any pain, like infections such as worsening pain, swelling, inflammation?
No.
Okay. Do you have any concussion that may affect your cognition or neurological disorders such as numbness, tingling?
No.
Okay. Have you been diagnosed with hypermobility?
No.
Okay. Do you have any systemic connective tissue, so it's just rheumatoid arthritis?
No.
Okay. And do you use any steroids right now, such as cortisol shots for the pain?
No.
Okay, perfect. So now that we have done that, we are good to continue with our joint mobilization. Our patient here is Miranda. We're going to be measuring her gastrocnemius length. So in order to do that, I am going to have Miranda face the wall. And since we're going to be measuring her left dorsiflexion gastrocnemius, her right foot is going to go forward and she's going to hold on to the wall. Like that. Now we're going to make sure that her foot is in the sagittal plane, and she's going to move forward until we see any heel lifting or knee flexion. So you can go. Okay, and that seems about good right there. So then we're going to get our goniometer and we're going to measure the angle of the dorsiflexion on her left side. So our axis point is going to be our lateral malleolus, and our stationary arm is going to be parallel to our foot and the floor, and our moving arm is going to be aligned with our head of the fibula. Okay. So her angle of dorsiflexion is 30 degrees. Now that we have Esmeralda here, we're going to do our joint mobilization, and as we can recall, we can find our spinous processes by our different landmarks, like our inferior angle, superior angle, spinous scapula, 12th rib, and iliac crest. So we're going to find her T7, and it's going to be by her inferior angle right here. So with our hypothenar eminence, we're going to place our hand right there on the spinous processes, and then just rest our hand, and then forming a C, we're gonna feel her joint mobilization, doing a posterior anterior glide on that joint. Okay, so grade 1, grade 2, grade 3, and grade 4. Okay, and going down, we can do her lumbar. So T12, L1. So with our hypothenar eminence, facing down. Okay. Grade 2, grade 3, grade 4. Okay. Okay.